Good afternoon, folks. Today's topic A, we are talking about the new landscape of aging. Okay, so here we go with the presentation I made for you. Please enjoy. I have spent decades in rooms where families speak in half sentences, the kind that tail trail off because finishing them would make the truth too sharp. In those rooms, I've learned to listen, not only to what people say, but what they cannot bring themselves to say. Lately, the unsaid has shifted. Families are no longer whispering only about prognosis of decline, but they are whispering about money, the quiet panic of realizing that the cost of keeping an older adult safe has become its own form of illness. It spreads through a it spreads through households long before the first hospice referral, long before the first hospital bed is delivered to the living room. I met these families at inflection points, a fall that changes everything, a hospitalization that reveals how fragile the situation has become, a sudden confusion that wasn't there last week. They sit across from me with folders of paperwork, medication lists, advance directives. Home care quotes they can't afford. And they ask, what are we supposed to do now? There is no single answer, but there is a story I see repeating itself everywhere. The home that can't hold the weight of aging. When I visit patients at home, I see houses doing their best to keep people alive. A split level with stairs that have become mountains, a farmhouse with narrow doorways that turn walkers sideways, a bathroom that has become a battlefield every morning. Families tell me, we want mom to stay here. They say it with love, but also with fear, because staying home is only possible if the home itself cooperates, and most homes don't. Renovations cost more than a year of Social Security. Even small fixes, grab bars, ramps, widened doors, add up. I've watched adult children stand in the hallway calculating what they can afford and what they can't, while their parent sits in the living room pretending not to hear. The house becomes a character in the story, stubborn, aging, and increasingly incompatible with the body it shelters. The care that exists, the care that exits only on paper. When families ask about paid care, I walk them through the options, but I do it gently because I know what's coming. Home care agencies quote hourly rates that reveal professional salaries. Assisted living facilities raise prices annually, sometimes mid-year. Skilled nursing facilities, once the fallback, they are closing or operating with wait lists that stretch for months. I've had to tell families that the care they need exists, but not at a price they can afford, they can pay. It is one of the most painful conversations in medicine because the suffering is not clinical. It's a structural. It is structural, and and it and is and it's predictable. Every week, I meet another family who has done everything right, saved, planned, prepared, only to discover that the system they counted on has quietly eroded beneath them. The the improvisation that becomes survival. And yet families adapt. They always do. I've watched them invent new models of care out of necessity, creativity, and love. Multi-generational living becomes a lifeline. A daughter moves in, or a garage becomes a small apartment. Cooperative caregiving emerges among neighbors who rotate meals and rides. Hybrid care takes shape as families learn medical tasks once reserved for nurses. Tech enabled oversight fills gaps with sensors, alerts, and telehealth check ins. None of these models are perfect. They are patchwork, fragile, and often exhausting, but they are also profoundly human. Evidence that care is not a commodity, but a relationship. Families are building new systems because old ones no longer function. They are rewriting the future of aging in real time, one improvised solution at a time. The emotional ledger behind the financial one. Palliative care, we talk about goals, values, and burdens. Increasingly, the greatest burden families name is not the illness itself, but the cost of surviving it. Adult children weigh guilt against burnout. Older adults weigh independence against safety. Spouses weigh devotion against the slow erosion of their own health. One patient's son told me, I'm choosing between bad and worse. He wasn't talking about the treatment options, he was talking about the mortgage. The emotional ledger is always longer than the financial one. It includes fear, loyalty, resentment, tenderness, exhaustion, and the quiet grief of realizing that a loved one, that love alone cannot solve the structural problems bearing down on the household. What this moment demands of us. As clinicians, we are trained to manage symptoms, guide decisions, and ease suffering. But the suffering I see now is tied to a system that asks families to carry more than any one household can bear. Still, I'm not without hope. The ingenuity and I ingenuity I see in living rooms across Pennsylvania and across the country tells me that families are already rewriting the future of aging. They are building new models of care from the ground up, even as the old ones crumble. But they cannot do it alone. Policy must meet them halfway. Caregiver tax credits, home modification support, Medicaid modernizations, workforce investment, and community-based care infrastructure. Without these, the strain will become unbearable. The future of elder care will be determined not only by what families invent, but by whether the system chooses to support their inventions. What I carry with me. Every time I leave a home, I pause at the doorway. I look back at the family. Tired, determined, improvising, and thinking. This is where the real work of aging happens. Not in the hospital, not in the clinic, but in the everyday courage of people trying to keep someone they love safe. The future of elder care is being rewritten, is being written in those rooms. In It is messy, tender, and deeply human. And as a palliative care physician, I'm privileged to witness it. Even as I fight for a system worthy of the people it serves. Okay, guys, that is A for you. I'll be back on with B shortly. Give me a bit for a small break, and I'll be back on with you. For now, Gator Wellness, take care, folks.